So the days that someone who truly cares about his patient's health considers amalgam as a safe and unproblematic filling material hopefully are gone. But even if you as a dental professional don't put amalgam in your patient's teeth anymore in your daily practice, you are facing the challenge of getting it out of your patient's teeth in a safe way on a daily basis. So if you're making these major mistakes while removing it, the increased exposure to mercury can intoxicate your patient much more than leaving the filling inside the tooth for the next decades. So to avoid the most crucial failures, we will talk about 3 fatal mistakes when removing amalgam which put your patients much more at risk than just leaving it where it is. Although amalgam consists of 50% mercury, the most toxic non-radioactive element on this planet, nevertheless it is still being used heavily worldwide. Only 2 countries, that's Norway and Sweden, banned amalgam around 2008-2009 as a dental filling material. In the European Union as a whole, since 2018, amalgam use has been banned for dental treatments of deciduous teeth, children under 15, and pregnant or breastfeeding women, except when it's strictly necessary due to specific medical needs, whatever those medical needs should look like, and so it's not really bad, you just shouldn't use it. The main reason is, by the way, fun fact, environmental protection from toxic mercury-containing waste. So not so much patient protection, but of course it's also of the raising health concerns of the population. So they passed, in my eyes, a symbolic regulation to take the concerns into account somehow. Especially so-called Western countries with higher income rates have meanwhile significantly reduced the use of amalgam as a dental filling material over the last years, but in poorer countries it is still heavily used because it's simply cost-effective and durable. So technically speaking, amalgam is a very easy to use and long-lasting material, no doubt, but from a health perspective though, as we already discussed in a previous video, it's also a long-term low-dose intoxication with one of the most hazardous elements you can think of. With only 3 amalgam fillings, you can easily reach the daily reference dose of 7 micrograms of mercury intake given by the EPA, the Environmental Protection Agency. But as I said in the beginning of this video, even if you as a dental professional don't use amalgam in your patient's teeth anymore in your daily practice, you're still facing the challenge of removing it in a safe way. According to the WHO, the World Health Organization, it is estimated that dental amalgam contributes approximately 270 to 340 metric tons of mercury to the environment each year. 270 to 340 tons of mercury, that's a lot. And how much of this mercury is removed under the right protection measures, do you think, huh? So let's talk about the major mistakes before, while, and after removing it. Number 1, don't overestimate your impact. What? Didn't I say that mercury is super toxic? Yeah, absolutely. And didn't I say it should be removed so it won't harm my patient anymore? Yeah, that's also correct. But what I want you to do is to take a broader perspective and get a realistic assessment of what you can do as a dentist and what else might be necessary to help the patient. Most of our patients have already had their amalgam fillings for years or even decades. But what else do they have in their mouth? Are there other materials as well? We will do a separate video about the effects taking place when there are different kinds of metal in the oral cavity, like the so-called toxic mimicry effect or the cumulative toxicity effect. But if you're only concentrating on amalgam, you might miss other important factors which may contribute to your patient's compromised health. So don't forget to ask your patient about his nutrition. Fish and other contaminated food can contribute massively to the overall intake of heavy metals and other toxins. So if someone comes to see you in your office seeking for help, maybe even having symptoms that could let you think about an intoxication with heavy metals like mercury, don't overestimate your impact in the situation, the bad health condition the patient has doesn't come from the amalgam in the tooth, but from the toxins that already have entered the system. It's a good idea to lower or eliminate the source, but depending on the number of amalgam-filled teeth, they might even not be the main source. So don't make the mistake to promise the patient an improvement of his health condition you cannot keep, because as I already said, everything you can do is to eliminate further intoxication, but you cannot treat the one that's already existing. And this brings me straight on to the second mistake you should avoid, which relates closely to the first one. Don't mess up the right treatment sequence. So what do I mean with that? I am not speaking about the single steps how to remove the actual filling. We will do a separate video on this topic, but before you start with the process, you need to know why the filling should be removed. Why? Well, because they contain mercury? Stupid question. Yeah, but that's not what I mean. What is the reason your patient wants you to remove the fillings? Does he or she already have symptoms of a heavy metal intoxication? Or is it more a proactive treatment to avoid further heavy metal intake, but your patient is in an overall good health condition? So I'm not talking about comorbidities like diabetes or high blood pressure. The point I want to make is that if your patient already suffers from an intoxication, the first goal should be to relieve your patient's body from the toxins which are already incorporated. Because depending on the level of intoxication, the patient might already have a reduced renal activity or liver function, for example. So the first goal should be to get rid of a huge portion of the toxins in the patient's body first, before you take action and care about the teeth. I know that many dentists say you always have to remove the amalgam first before you start to detox. And this is true to a certain degree because some measures like a chelate therapy can result in increased release of mercury from the fillings as well. But I will always make a decision what contributes to the patient's overall health and structure the treatment process as necessary. A second thing which gets pretty obvious with those thoughts is that you always need good co-therapists, like doctors who have a high knowledge about detox protocols and therapies. Because if your patient already had a significant amount of heavy metal intake, you won't help him with some chlorella tabs, and as the mercury is strongly bound in the tissue, so to get rid of these toxins, you need something that pulls it out of the cells and the tissue. And last but not least of the biggest mistakes when removing amalgam fillings, don't miss 2/3 of the equation. When you're removing amalgam in your office, there normally is the patient, and you might use a silicone-free rubber dam and a high-volume evacuator, and that's fine and necessary, but besides your patient, there is you and your assistant sitting next to the patient and above your patient's head. So when you're cutting the amalgam, due to the friction and heat, there is always some mercury-containing vapor rising from your patient's oral cavity. So most of it might be caught by the HVE, but there still can be small amounts which are then inhaled by the next two evacuators, and that's you and your assistant. So a significant part of the protection measures should involve you and your assistant as well, like an air ventilation system, which takes in the air above the patient's head and filters it, or like a gold-covered face mask for you and your assistant, because mercury binds strongly to gold, so the mask will catch it before it enters your lungs and your bloodstream. So the single dose of mercury released by 1 or 2 amalgam fillings while being taken out is not the problem. But if you're doing it for years, day by day, it's the same everyday low-dose long-term intoxication effect that your patient has with the fillings in their oral cavity over decades. I myself just had a unisphoresis done twice, and there were significant high levels of heavy metals filtered out of my own blood and tissue. Unisphoresis is a method where a special machine filters heavy metals, aluminium, microplastics, tumor cells, bad proteins, and more from your blood. And as your blood gets cleaned, the body releases more toxins into the bloodstream, which were stored inside the connective tissue, etc., and then it can be again filtered out of the bloodstream again. As I never ate much fish, for example, and I also didn't live in highly polluted areas, I consider as one of the major sources for my own heavy metal pollution my past as a non-biological dentist, and the time when I removed amalgam without any special protection measures for myself. So if you wouldn't use a rubber dam for the patient, for example, it wouldn't be good for your patient, of course, but this intake is limited to the amount of mercury dust and vapor set free from his number of fillings. But for you, every day is a new source of intoxication, so not only take care about your patient's health, but first and foremost, take care of yourself and your employees. So to wrap it up, removing amalgam from your patient's teeth can contribute heavily to their overall health, especially on the long term. But the removal of the amalgam doesn't cure any symptoms they already might have from an intoxication. So in such cases, you need to refer your patient to a doctor who's a specialist for detox treatments and set up a comprehensive treatment plan together. And don't forget to protect yourself, because you're putting your own health at risk if you don't include measures which avoid your own exposure to heavy metals and other toxins in your everyday practice. So if you want to learn more about biological dentistry, metal-free dentistry, and other concepts, then make sure you subscribe to the channel and check the links in the description box below. Always take care, and always remember, if we can do better, we should do better.